actually think it will hurt the passage of the bill, because I think the rushed nature of it was what was getting traction. I think as more Americans understand the impact and the expense it's going to take and the incredible consequences of having a national health care program that isn't well thought out, I'm hopeful that it will slow the passage of it down.
Whether they recess or not, I don't think they're going to come to a full agreement on the bill.
I think there's more to it than what we're being told.
It's probably going to be a bad thing for it because the senators will think about it and probably decide they don't like it.
Give them an opportunity to go back to their constituents and get the reaction, and let them, contemplate the bill and read the bill over the 3 weeks that they're off. Hopefully they'll do that.
I think the government should stay out of health care and it should be up to the private sector. And my preference is they don't do anything after the recess and they let the free market economy manage health care.
At least the condensed version so that they can understand how it's going to impact all of their constituents and share that information, because it's very important when you're going to talk about healthcare expenses of it and the expectations of what you want in healthcare.
Yeah, I think before you vote on anything, you ought to read it. And I know that many of them do not. They trust what they've been told, but they've never read every word of it, and they should.
Depends if they take the time to read it or not. It could help it if, help make them an informed decision if they read it, but if they just take the time off and don't read it, then I think it'll just be the same.
And I think that they should have to probably read it to understand what they're really passing.
It's about 500 pages. They should definitely read it. I read everything before I sign it.
Vote on it, they should read it. Or if they don't read it, at least their aide should read it and give them little cliff notes.